Welcome everybody, ladies and gentlemen, to the QNU's 2012 State Election Health Forum on this very important event, and it's also International Women's Day today. Firstly, I would like to acknowledge the past and present traditional owners of the land, the Jagera and Turrbal people. Secondly, I would like to acknowledge and thank our guests tonight for attending. Tonight we are joined by the Member for Ferny Grove and the current Minister for Health, the Honourable Jeff Wilson MP, the Member for Caloundra and Shadow Minister for Health, the Honourable Mark McArdle MP, the current Member for Beaudesert, who is representing the Australian Party, Caddi's Australia Party, and the Honourable Aidan McClinton, and the Greens candidate for Mount Cootha, Adam Stone. We also have in attendance tonight the Secretary of the QNU, Beth Moll, and the Assistant Secretary, Des Elder, as well as a number of councillors and members from across the state. The Queensland Nurses Union is the industrial and professional organisation for nurses and midwives working in public and private health and aged care in Queensland. The QNU seeks to promote and defend the industrial, professional, social, political and democratic interests of over 48,000 members. The members include registered nurses, midwives, enrolled nurses, assistants in nursing, however titled, students and anybody who undertakes nursing work. There is no other organisation in Queensland which provides comprehensive representation for nurses and midwives as both employees and professionals. Members have the opportunity to be actively involved in the Queensland Nurses Union and decide our priorities through the union's democratic processes and structure. The 2012 Queensland state election is of critical importance to our members. The result will determine and shape government priorities and policies which help influence the practice of nursing and midwifery in Queensland. We have asked our members to submit questions through the QNU website, and we have selected a number of these for you all to speak to tonight. Each speaker is going to be given 5 minutes in an opening address. We will then ask questions and each speaker will be given 2 minutes to respond. I will ring the bell, gentlemen, at about 1 minute 30 seconds so that you know that your time will be up. The order of speakers will move from right to left and then from left to right so that everybody gets an even opportunity to speak. Now I'd like to invite the first speaker, the Member for Beaudesert, who is representing Caddi's Australian Party, Aidan McClinton, to commence the first of 5-minute introductions. Please make him very welcome.
Thank you very much, Sally Ann, and it's a pleasure to be able to represent the Australian Party here today and also to be able to address the 48,000 members of the QNU. I think we've seen in a 5-minute speech, of course, we don't want to concentrate on the negatives, but I think what we should be doing is concentrating on what we can do. In fact, I also would like to acknowledge the candidates for Budrum, Lynette Bishop, who's been a member of the QNU for 30 years as from next year, and also John Matheson, who has been a registered nurse since 1983 and specialises in mental health. He's the candidate for Condamine. Thank you very much for coming. I think it's about time that I think one of the misconceptions about politicians is that the public assume that politicians know a lot about everything, but the reality is we know a little bit about a few things. And one of the key things in the political world is representation, whereby you guys, the 48,000 members, present to us, we represent that then to the Parliament. And I think that's where therein lies the biggest disconnect we've seen in politics, particularly in the last 10 or 15 years on all levels of government. Health has been a topic of hot debate for the last 20 years in the household. I was one of 9 children. We had four chiropractors, a nurse and 2 doctors, so you can imagine the conversations that took place. I ended up being a politician, but someone had to draw the short straw. You must be very healthy. Very healthy indeed. And, but what I think we've seen, and we released our policy, the Australian Party released our policy 8 days ago in the Renew, Restore and Reinvigorate the health system. And what we need to understand is that we've seen, in the last 10 years, some 45 maternity wards closed down. We've seen a centralisation of services. And I think it would be fair to say that the government has become its own worst enemy in terms of the bureaucratic nightmare that we've faced and we've seen in recent events, but also the fact that you're looking at a ratio of around 5 bureaucrats to 1 nurse or doctor by the bedside, and I think that should be the reverse, to be quite honest. That ratio should be the reverse. It should be 1 to 5, not 5 to 1, and we've seen huge amounts of money being spent across the state. Mount Isa, $67 million revamped in the hospital, not 1 extra bed. So what we want to do is also provide incentives for the nurses in terms of their training a couple of the points to ensure patient and nurse ratio is maintained at the most effective level, to promote and encourage the career opportunities and professional development that is directed to clinical outcomes and direct healthcare delivery, to reduce the burdensome and excessive and unnecessary red tape, administrative process and paperwork, to focus on expansion of midwifery services throughout the state, paying particular attention to rural and remote areas, and provide incentives and programs for rural and remote nursing with necessary training and educations. And I think we've got to get this mindset out of the way once government starts having a philosophy of centralisation, then you have, of course, the ripple effect, and as we all know, a fish rots from the head. So, of course, if you get it wrong at the top, the ripple effect for that can actually completely demoralise the whole culture of the nursing sector. And we've seen that of many nurses, particularly with what we've seen in terms of the payroll debacle was one of them. That's sort of the culture and the morale of the nurses on the front line who are doing one of the most important jobs in terms of maintaining people's dignity in the health system is absolutely critical. Because I can tell you now, if the politicians if our pays were cut within 24 hours, you can rest assured that would be fixed. So I think we needed something as simple as putting the checks in place, but we've got to make sure that we simplify these systems and make sure that the morale and the culture in the nursing sector is at an all-time high, because they have got huge potential. We're reaching exciting times, and I believe we're on the threshold of a new political era in both state and federal politics, which will provide enormous opportunities for the QNU to have input in terms of the direction, because the last thing that the 48,000 members of the QNU want to do is to be told what to do rather than advise us what should be done. And I think if we get that connect right in the first place, I think you'll have far better outcomes, and you'll find the nursing sector can indeed reach its potential and lift the morale right across the board. I think also we have to make sure that a lot of qualified nurses end up getting stuck in the admin and logistics of it, and what we need to do is make sure that we can streamline the bureaucracy, cut the red tape, and make sure that the nurses who have put their hand up to do the job are empowered to do that job. And I think until we have that mindset, that these nurses that of course often... 1 minute to go? 30 seconds, wow. Politicians can talk, can't they? So obviously we have a health budget that's in excess of $11 billion. So there is no excuse. There is no excuse for some of the things that we've seen, particularly in the last 3 to 5 years in the health sector. I will also say that we need to also recognise the unique role of the nursing within the health system, the only professional system that provides 24-hour continuation of care. And I think that's something that all politicians from all sides need to bear in mind. And I think we look forward to renewing, restoring and reinvigorating. And as Dr. Richard Kidd said, we don't want any band-aid solutions. We want a long-term strategy to improve and empower the nursing sector.
Thank you very much, Aidan. Thank you. I would like now to hand over to the Honourable Jeff Wilson, who's our current Minister for Health.
Well, good afternoon, everyone, and thank you, Sally, and thank you, Beth, and to the QNU for organising this forum. Can I firstly acknowledge the traditional owners of the land upon which we meet, and secondly, recognise all of the women of today and of the generations past as we celebrate International Women's Day. And what better day to be having an event auspiced by the Queensland Nurses Union than International Women's Day, and I suspect it wasn't an accident. Ladies and gentlemen, nurses are at the heart of our healthcare system in Queensland, and across the state we are working hard to deliver more services sooner and closer to home for Queenslanders. Nurses, frankly, are the backbone of our health system and of the mission that we pursue. So I wanted to commence this afternoon by saying, on behalf of the government, thank you for the work that you do. On behalf of the government, on behalf of every person who has either received first-class, world-class treatment in our public hospitals or anticipates to do so. Protecting Queensland's nurses, protecting their jobs and protecting their conditions and protecting their safety at work is a passion for this government, which we share with the Queensland Nurses Union. The government is committed to working with the QNU to deliver real wage growth for Queensland nurses, and if re-elected, we undertake to deliver EBA 8 in the first 100 days of the new Bligh Labor government. I know we have points in that negotiation where we don't see eye to eye. It is an EBA negotiation after all. But I can assure you that up to this point we have been working very, very hard to resolve those issues in good faith so that we can ultimately deliver an agreement. We're focused on the future of nursing. The government believes that this is the significant contrast between what we have been doing and what we propose to do and the alternative through the opposition. One of the most glaring issues for this government, we believe, is making sure that we craft the future around a vision for nursing as a profession, a fully fledged profession within Queensland. Just yesterday, as part of the launch of Annabelle's new men's health policy, we have committed to providing 12 nurses who will be dedicated to prostate care and the testing and treatment of prostate cancer. This, I underline, is a pilot to look at how we may do this and roll it out across the state using really the unprecedented example of what we do, what you do so well in addressing breast cancer and the treatment of breast cancer. We're also delivering on nurse-led discharge. It means nurses making tough clinical decisions, working with patients towards getting them back on their feet and back home sooner. One of our proudest achievements, opposed, I must say, by our opponents, was the creation of nurse practitioners. And I'm proud to say that as a result of the Bligh government's commitment, Queensland has the fastest growth rate in the number of nurse practitioners working on the front line. What's more, nurse practitioners in Queensland now have the authority to prescribe medication, enhancing their capacity to provide greater health care to more Queenslanders. This is fantastic for nurses as it builds a new career path for them, but also for Queensland patients who most stand to benefit from the world-class care that they will provide. One of the surest ways we can protect nurses in Queensland is pretty simple, actually, to hire more of them. At the last election, the government put forward a target to increase the health workforce by a further 3,500 nurses, doctors and allied health professionals. Well, as of January this year, we had employed 6,600 additional clinical staff, the overwhelming number of those being nurses. So the government sets goals and we endeavour to exceed them. I must mention, of course, that I do really understand that the staff have been and many remain angry about the failure of the payroll system, and rightly so, and I again want to apologise to staff for this and the pain that it has caused. As a former trade union official who has worked with and for workers across many industries across Queensland, nothing rankles me more than that. So I can't stress enough that the government takes the responsibility that it does have to treat its employees decently and to ensure they receive every cent of their wages and entitlements on time and accurate. Getting all of this right will take time, but I give you my commitment that we will work tirelessly until the job is done. I want to also, in that regard, acknowledge the splendid role that the QNU, very vigorous role I should say, the QNU has undertaken in representing members' interests in that regard. So, ladies and gentlemen, we are committed to building the profession of nursing and midwifery here in Queensland and doing everything that we absolutely can with an unprecedented budget in rolling out more and more opportunities for nurses and midwives in our public health system and the health system more broadly across Queensland. Thank you very much.
Thank you, Jeff. Ladies and gentlemen, I'll now hand over to the Honourable Mark McArdle, who is the Shadow Minister for Health at the moment.
Thank you. I'm going to stand, if I can, just for the 5-minute address. I want to start by acknowledging Sally Ann Jones, President of the QNU, Beth Mole, Secretary of the QNU, my colleagues here at the front table for the work that they've done in getting here today during the election campaign, but more importantly to you here who are providing the services we need so much across this great state of ours. People often say to me the future of health delivery in this state is difficult, and of course it is. Of course it is. And there are one phrase that I use to indicate where our problems are going to lie: ageing and chronic disease that is sweeping this state in numbers and proportions like a tsunami that we're going to have to deal with in the public and the private health sector as time goes by. They also made the comment to me that we are, at this point in time, at the crossroads of delivery of health services. And we are. We now have the greatest opportunity, in my opinion, for many, many years to deliver a health service by looking at the networks or hospital boards and the Medicare locals, the GPs and primary health care working together over time to deliver real outcomes across the state. The networks, in my opinion, are pivotal for the acute system to function properly in this state. And the LNP is committed to a board structure that incorporates nurses in the major decision-making processes and clinical outcomes across the network to deliver those, and it's necessary and required outcomes across Queensland for people who live here and their families. The networks under an LNP government, I can guarantee you this, is going to be very independent. If I become the health minister, it is not going to be my job to run a network. It is going to be the network's job to deliver clinical outcomes on the day for their community, for their region and for the public. I'd want them to be standalone as much as possible in clinical issues. I also make the point very clear that if we appoint a network which will consist of you people and your colleagues either on the board or on the ground making decisions about what should happen, there will come with that a responsibility. And if you don't deliver, I make no qualms in saying the board won't be there, because we're going to demand excellence just as they're going to demand from us support, fallback position and assistance. I want corporate office to be a body that looks at statewide planning across a range of issues, working in with the networks. I don't want the networks to be controlled by Brisbane. I want the networks to control themselves. That's what they're made to do, and that's what they will do. The other issue is how we link the networks into Medicare locals. Medicare locals are playing in a very crowded field at the moment. No one quite understands what their role is going to be across the various sectors. But when you consider Medicare locals in primary health care, you've got the AMSs, you've got the APCCs, you've got super clinics, you've got the GP divisions, not all who are morphing into Medicare locals. Some are going to maintain their own individual status in the primary health care sector. We need, if we're going to achieve the network outcomes that we want, to achieve a Medicare local principle that is going to define a collective, collaborative plan for the future. If we don't get this right, if we don't get the plan right across those sectors, I can guarantee you we will have worse outcomes in 4 or 5 years' time. And that's where nurses become important. The Minister made the comment that I don't support nurse practitioners. That's not right. Nurse practitioners are, in my opinion, only the start of nursing education and development as time goes by. I've made it quite clear that as far as I'm concerned, I want the chief nurse to work hand in hand with the QNU in developing education, standards, and also developing the practice that nurses can undertake in many years to come. I see a real collaboration between the chief nurse and the QNU and the Minister in forming that cohort to move forward with the networks and also with Medicare locals. In 2005, Peter Forster, in his report, targeted 2 issues. If you're going to have a system that works, you have to have leadership and culture. Leadership and culture. If you've got leadership, you'll get the culture. We want to give the networks the right to lead, so that they lead the clinicians and the nurses, allied health professionals on the ground. We want Brisbane to stand back from that, not controlling day to day, and allowing nurses and doctors to look at what needs to be done on the ground right across the state. I was in Mount Isa just this afternoon and yesterday. You can't compare Mount Isa to RBH as to what's required. The change is coming. We have to work together to make it happen.
Thank you. I'd now like to welcome to speak Adam Stone, who's the candidate for Mount Cootha for the Greens. Adam.
Thanks. Can you hear me okay? Yes. I think a well-structured, adequately resourced and importantly properly staffed health system is indisputably a central function of any government. It's one of the main services they provide to the community. And the nursing profession is obviously central to the health system. But from what I've been reading, it's not easy being a nurse in Queensland at the moment, with significant staff shortages that are projected to get much worse in the short term, and some significant pay inequities, especially for nurses working in the aged care sector, and now also a lot of uncertainty surrounding the pay and conditions that will apply to your profession going forward, given the unresolved enterprise bargaining agreement, and also, particularly alarmingly, escalating rates of violence and accident and injury befalling nurses on the job. I think it's small wonder that the profession is struggling to recruit and retain adequate numbers of appropriately skilled and qualified nurses. So for those nurses who do remain in the health system and keep providing these essential services to the community, thank you. I think the Greens and the Queensland Greens in particular find that we are in significant agreement with the recommendations and the requests of the nursing profession as expressed through your union. We think there does need to be greater recruitment of nurses. There do need to be more nurses moving into the public health system. There are a lot of qualified nurses graduating but not being recruited, and that needs to be turned around. We do need greater incentives and support for nurses to be working in regional and rural areas where the need is so great. There is a need for greater money to be spent on training and professional development, not only to ensure an appropriate skill mix amongst the workforce, but also to ensure that the workforce remains engaged and feels like there's some progress to be made. In that regard, I think having a pay structure that rewards the accumulation of experience is also important for keeping people engaged and giving them some sense that there is career progress to be had within the system. And I think most of these things are uncontroversial. I think they're non-partisan. I think probably anybody would agree with the statements that I just made. But I think the problems that we run into is having an overstretched health budget and how do we pay for all of those things. And I think that's kind of where the Greens make a bit of a unique contribution in our focus on primary and preventive healthcare and trying to put more attention on keeping people well and keeping them outside the hospital system. In Queensland, as in Australia, and in fact as in most advanced Western liberal democracies, health spending's on an unsustainable trajectory. Year by year it increases as a proportion of gross product, and I think you don't need a Green with our emphasis on sustainability and long-term perspectives to tell you that that's unsustainable. It has to reach a point where that can't keep continuing. In Queensland, the increase in health expenditure has been particularly dramatic, and it's more than doubled since 2005. Over 70% of what we spend on health in Queensland goes on the hospital system, and less than 5% is spent on prevention. Yet we know that over 30%, while I'm rattling off numbers, of what it turns up in our hospital system is from preventable causes. And so just a couple of weeks ago, the Queensland Greens launched some proposals to try to bring more of a focus onto primary and preventive healthcare and keeping people outside the hospital system. And the importance of that, I think, for the nursing profession is not only the role that you can play in primary and preventative healthcare, but also if we can shift some of that burden outside our hospital system and keep the hospital system more focused on acute, unpreventable medical needs, which is its proper focus, then that means in the longer term, more public resources available to attend to precisely the things that you're asking for, to ensure that your salary increments do at least keep pace with inflation. There is more money for professional training and development, and there is more money to hire and recruit more nurses. So a couple of weeks ago, we launched a proposal for a Queensland Health Promotion Foundation, which is based on the highly successful Victorian equivalent, which would give us an independent statutory authority to start harvesting some of that low-hanging fruit of prevention. We also suggested another $25 million go into community-based mental health services, particularly in the highly successful housing and support program, which was independently reviewed in 2010 and was shown not only to improve outcomes and quality of life for people suffering mental illness, but to lead to significant savings in the health system because it keeps people out of hospital. Was that the end? Or was
That's
that
the
30
end,
seconds?
Adam.
And just imagine I said all sorts of wonderful extra things.
Cut. Thank you. Okay. And the reason I'm being a bit tight with the time is I've got a million questions to ask you from people all over the state, and some people in the audience have some of those on their laps. So I'd like to hand over to the first person with the question, and that's Debbie Watt from Brisbane. Deb, you can stand up if you like. Might be nice for the people in the back. Thanks, Deb. And in response, we've got 2 minutes to respond for each member of the team who's up on the panel here, and I'll be timing those, and I'm going to start with you, Adam, first, and we're going to work this way. Okay? Go for it.
This is on?
Yep.
Hi, I'm Debbie. I'm from Townsville. First of all, welcome this evening. Thank you. And the first question is, how will your party ensure that nurses and midwives have a strong voice in the local health and hospitals networks? And how do you envisage the operation of the local health and hospital networks from July this year?
Yes. Thank you, Adam.
In terms of having a strong voice, the Greens are very union friendly. I mean, I think we've sort of become over time the custodians of IR and unions and collective bargaining and so on. And we always put a strong focus on ensuring that the workforce always has a place at the table through their union representatives, whether that's in these new networks or any aspect of any area of health and the health workplace. I think that's probably a key way that we would see that happening. We would always protect the role of unions in the workplace. What was the second part of the question?
It was...
Strong voice, and how do you envisage the operation
of the
operation of the local health networks?
I don't, I must confess, because I don't know enough about it.
Thank you. Adam.
Okay, can I just take the second point first? I think I did make comment about this earlier. I just see the networks as being a standalone clinical body to deliver the outcomes on the ground for the community. Now that would require that body also to engage with the community, to make certain that they are getting feedback and explaining where they're going to with the community, and also to lead, to interact with the lead local clinicians and the national lead clinicians group as well. So they're getting advices from medically qualified people to assist them to run. As I said, the position of Brisbane would move away significantly from what it is now, because I simply don't see how I can, as a minister, if I become the minister, run Townsville Hospital. It's simply impossible. I can't run Cairns. So I want the networks to be standalone, independent, and come into Queensland Health for appropriate issues to be dealt with, and for Queensland Health in Brisbane to actually have the plan on the ground to develop statewide policies. In relation to nurses and midwives, of course Adam is right. It is a matter that the nursing fraternity across the sector would play a significant role in either the governing council, or at least in regard to the various arms that would fall from the governing council to direct what is needed for them on the ground, but also to feed the community feedback into the governing council as to what they see the issues are and how to be dealt with. So I think the issue of nurses and midwives down the track will become more and more important as time goes by. And I understand that the governing councils, if we are the elected government, will be required to deal directly with those issues on an ongoing basis, for the simple reason that they are community-based, they need community input, and nurses and midwives deliver that on a daily basis.
Thank you. That's great. Minister.
Time running?
Yep, your time to go.
Well, we passed legislation through the Parliament late last year, actually setting this up, setting up the networks and requiring under legislation that each of the governing councils establish a clinical engagement strategy as well as a consumer and community engagement strategy. So with the clinical engagement strategy, that requires the governing council to set up a structure within that network, for example, Metro North, to involve doctors, nurses and allied health professionals in providing advice, comment, information and serious input into the decisions made by the governing council. So we create a structure whereby they get a voice. But more than that, we actually create security for nurses so that their voice can be said and heard without any sense of vulnerability. How do we do that? We legislated to require that all nurses and all staff of Queensland Health remain employed by the Director General and are not employed by the network. So you can have confidence in the security of your employment, no matter which network you're working for, that you're employed with the Director General. And so you can speak up with a loud voice, confident of your security of employment. Thirdly, we want those district or those networks to re-examine the structure of decision making within the network and within each hospital. Many practical decisions are in fact made by nurses that are undervalued for the decision making that they are involved in. There needs to be a restructure of decision making within those networks to empower nurses who are the frontline workers, who know better how to make not only the clinical decisions, but the management and the administrative decisions for the effective deployment of resources within that hospital and in that network. So that's one of the tasks of the new network, to take that up and put all that together, and you will have an unprecedented opportunity for nurses to not only have a say but be real decision makers within that network that we've already legislated for.
Thank you, Minister. Aidan.
Thanks for the question, Debbie. If I got $1 for every time that somebody said, "I wish we had the local health boards back," I'd be a very rich man. And I think if it did work before, it can work again. Obviously, we have our ideology for our party is it certainly comes from a decentralisation point of view. I think what we need to do is empower those local boards also to make those decisions. As we've seen, as I said earlier on, we centralise the whole process. It becomes gridlocked. So I don't see the money spent on decentralising and empowering these local boards as expenditure. I see it as an investment, because for every $1 that you empower those local boards, you save $2 from the gridlock that we're currently faced with. If I can give you an example, the Badesett maternity ward was taken out in 2001, the area that I would represent. We now have 800 babies being born annually in the catchment that all go to Ipswich, Gold Coast and Logan. So they have to join the queue. Some mothers in Boone or Rathdowney have a 5-hour turnaround for a 5-minute checkup. And this is the sort of madness that you get. So now you have a frustrated patient and, of course, the burnt-out nurse at the other end as well. So what you're doing is the friction between the patient and the people in the frontline services is there before they've even met each other. And, what we've actually got to do is decentralise. I mean, we just keep building and more and attracting more and more people to Brisbane, and everyone loses out. The regions loses out, Brisbane loses out. Let's get a helicopter view and say, where can we start getting people to have smaller queues? And if that means directing some resources from one hospital to another, so be it. The disparity that we're seeing now is costing the taxpayer huge amounts, and of course delivering a rather sloppy service in terms of what the constraints are on the nurses can provide. So of course the nurses are trying to do their best, and they always end up copping the flack from a weak political system. Also, I think that any legislative change needs to be driven by those who have the direct impact of that change. They need to drive the change, not the politicians. We need to depoliticise the departments, typically the top echelons of bureaucrats, and let's start getting a proper structure back in place so that the community's empowered, the local health board can deliver, and the QNU has the necessary input to any legislative change.
Oh, good timing. Thank you, Aidan. Thanks, Debbie, for that question. The next question is from Carol Lewis, who's here to ask it. It's about EB8. Carol. And Aidan, you'll answer first on this question.
Good evening. My name is Carol Lewis. I'm from Brisbane. Our union has tried very hard to finalise negotiations for enterprise bargaining with Queensland Health prior to the government going into caretaker mode. Our current agreement expires on the 31st of March. 5 months of intensive negotiations have taken place, and we have reached agreement with Queensland Health on a large number of issues, with only a small number of significant issues still to be negotiated. We do not want to have to go back to square one and recommence negotiations on those issues we have already reached agreement on. We want to see negotiations on the outstanding issues concluded within 1 month of the 24th of March 2012 poll. Nurses and midwives need certainty and want to see a fair offer made to them, one that demonstrates that we are valued for the contribution we make on a daily basis. Can you give a commitment on behalf of the party that you represent that you will negotiate in good faith to reach an agreement with Queensland Nurses Union on the outstanding issues within 1 month if you are elected to government on the 24th of March 2012?
Thank you, Carol. Aidan.
Thanks, Carol, for the question. it goes without saying that the good job that the nurses and the frontline services do. Yes, I can commit there will be a lot of people on the wish list for that 1 month, but I can't see, in terms of a lot of the issues facing us, anything more important than providing the people on the front line to be able to reach their potential by empowering them, making sure they get the right money. In terms of the progress you've made so far, we would be happy, the Australian Party, to take off where we've left off and resolve those other issues that still need resolving. It would be ludicrous to go back to square one. It would only waste your time and the politicians' time as well, and you'd probably end up reaching that same agreement anyway. So yes, we're prepared to take off where you left off to resolve any outstanding concerns that you have. And I would certainly say, when I was talking to the Together Union recently, I think at an absolute minimum, we've got to look at CPI in terms of pay rises. It's just not fair to have 2 or 2.5 and you've got to keep going cap in hand when we've really got to give you the money to do the job in the first place. Because I think we're on exciting times though, because you guys have so much input in a new government, and we'll be in a position of power to ensure that you get well looked after to provide the service that Queenslanders expect.
Thank you very much. Minister.
It is absolutely right that we have made a lot of significant progress in the negotiations to this date, and there would be no reason why what has already been agreed to isn't the starting point for finalising those remaining issues, and there's only a small number of them, but they are the more significant ones in terms of long-term planning and budgeting. And I can give you that commitment. One, that we will resume negotiations where we left off. 2, that we will conclude the finalisation of the remaining issues within that 1 month. 3, that we will bargain in good faith, as we have done, and I believe that's been reflected by the union's negotiating approach, all focused on making sure that we do our very level best to build the profession of nursing in Queensland, along with a very careful consideration of how we plan for the development and professional development of that profession. The long-term planning for training, retraining existing workers, for upskilling other workers, and for training new workers coming into this sector is absolutely vital for us to secure the long-term sustainability of our health system. So it's not just an EBA finalisation, which I can commit to within that first 1 month, but that needs to be on the basis of a longer-term consideration of where are we going over the next 5 to 10 years in building the workforce. An EBA is 3 years. We actually need a longer time frame, which is the context inside of which we then negotiate the important elements of the EBA. So I'd be delighted to resume the negotiations, despite the fact that it can be a bit tough sometimes. The QNU take no quarter, spare no quarter in their negotiations, I can assure you. But goodwill on all parties' part really helps resolve things as quickly as possible.
Thank you, Minister.
Thank you very much. Can I start by saying that the LNP has not been a party to these negotiations. I have read the email or the media release of 21 February 2012. It doesn't provide detail here as to what are the increased rural and remote incentives we're talking about. It's impossible for me to comment upon a document, the content of which I do not know. It's impossible for any person to enter into a bargain on a document, the terms of which they do not understand and were not party to negotiations. But I will say this to you. I'll give you a commitment that if the LNP is elected to government, and if I become the Health Minister, we will within 100 days have entered into the EB8 with the QNU. Now I can't do more than that because I can't commit a party to a financial situation of which they were never a party to by way of negotiations. That would be the wrong thing for me to do. But we will commit to within 100 days we will have struck a bargain with the QNU. And I think the other point is this. I think we talk about the issues of, as the Minister said, EB8 being 3 years. I agree. We want to develop a workforce and a proposal that takes the workforce not 3 years, not 8 years, but 20 years into the future. There are enormous pressures on nurses at this point in time. The nurses are facing a growing ageing population within their own ranks. There are also major concerns into how they deal with the new techniques, the new medications and the new issues that are coming forward. Those are also part of growing a workforce. So again, I repeat, I can't commit to that because we weren't part of the agreement, but we will commit to, within 100 days of being elected, finalising an EB8 agreement with the QNU, because again, we understand the role of nurses in this state.
Thank you very much. Adam.
I think probably Mark's caveats are well made, and I obviously also am not aware of the detail, but what I am aware of about some of the outstanding issues, I have trouble imagining that the Greens would have any significant problem with it or would be unable to reach agreement within the kind of time frame that you're talking about. Issues to do with more resources for training and professional development and greater incentives to get nurses working out in rural, remote areas, etc. Those things are all already explicitly in Greens policy. So, I'd say it would be very likely, with the caveat that I don't know exactly what all the details are, that we'd be able to finalise an agreement in that kind of time frame. And we certainly wouldn't want to see the kind of drawn out and sort of damaging dispute that's been happening in places like Victoria. And I think, you know, the record of the Greens tends to be that we stand up and make a lot of noise when we've got a foothold in Parliament on issues like workers' rights and entitlements, and we've done that in New South Wales and Victoria, so I think you'd see the same thing from us here.
Thank you, Adam. That's a perfect segue into our next question, actually. Dan Prentice is here to ask you it, and it is about industrial relations, actually. Thank you, Carol, for your question.
Sally, panel. The question is this. Along with nurses and midwives in my workplace, I'm extremely concerned about the attacks on the industrial rights of our colleagues in Victoria and New South Wales. In Victoria, there's been a bitter dispute that has lasted for around 6 months for the public sector EB deal for nurses and midwives. A critical element of this dispute has been the Victorian government's attack on patient-to-nurse ratios. In New South Wales, the state government there has legislated to cap pay increases for public sector employees, including nurses and midwives, to 2.5% per annum, while at the same time legislating to remove the power of the independent umpire, that is the Industrial Relations Commission, to arbitrate such disputes. Recently, a Commission of Audit report being considered by the New South Wales Government recommended that workforce agreements such as staffing ratios should not be included in the industrial instruments. In Queensland Health, the workloads tool that is mandated in our industrial instrument is the business planning framework. Queensland nurses and midwives know that their industrial arrangements not only protect their rights at work, but also the quality of care that they can deliver through staffing methodologies contained in industrial instruments. Importantly, these attacks on the industrial rights of nurses and midwives were not flagged before the last New South Wales or Victorian state elections. Can you give a commitment that the Queensland nurses and midwives will be safe from similar attacks that have occurred in Victoria and New South Wales should your party have a role in government on March the 24th? Thank you.
Okay, thanks, Dan. Adam, if you respond, and then we'll go across this way. Thank you.
Sure. Yes, I can absolutely commit to that, and I think, as I was sort of pointing out, I think our record substantiates that in those places, which is all other states where we have a presence in the Parliament. I absolutely would not countenance the idea of holding the wages or wage increases of nurses or any workers where we have to say public sector workers below inflation. And I also don't agree with the idea that things like things affecting the way that your workplace operates, such as nurse-to-patient ratios, should be off limits to enterprise bargaining. I think obviously the workers are one of the main groups of people with real insights into how the workforce can operate effectively. And where your ability to influence those sorts of outcomes have been curtailed in other contexts. So if you take, for example, the Australian Building and Construction Commission and the way that criminalised some aspects of where workers would take legitimate industrial action to try to protest about workplace health and safety concerns, for example, in their workplace. We've actually seen statistically this increase in the number of deaths and injuries in that industry as a result. So I think it would be rash and irrational to try to exclude those kind of workers' insights that the workforce can bring.
Thank
The
you.
commitment is this. The LNP will not remove any of the rights you've indicated under any circumstances. We understand the QNU, we understand their role in bargaining, understand the Industrial Commission as well. It's as black and white as that as far as I'm concerned. We will not take anything away whatsoever.
Thank you. That's very clear. Minister.
I can unequivocally give the guarantee that has been sought. And that reinforces the observations I made earlier about our approach to finalising EBA 8. This government will not be capping, legislatively capping the wage increases, will not be abolishing, in the public sector, will not be abolishing the role of the Industrial Commission in the resolution of industrial disputes and EBAs. We will not be proscribing and banning issues that are so critical to the industrial rights of workers, such as the business planning framework, which is the Queensland vehicle for delivering an appropriate correlation between staffing numbers and bed and patient numbers. So you can rest entirely comfortable tonight and thereafter with the commitment of this Labor government, of which I am a very proud member, that we will be doing our very level best to get the best for nurses in our health system in the resolution as quickly as possible, as I said, within the 1 month of the EBA. And it is the importance of that is complemented by what I said earlier to a couple of other questions, and that is that we need to engage the frontline staff in the way in which decisions are made within our hospitals and our health networks to harvest the innovation and ideas that frontline workers have in the way in which health services should be delivered. So we need to put away the EBA 8, get that done and dusted, to move on to the innovation that is needed in our health system.
Thank you.
I'm committed to that.
Thank you very much. Aidan, would you like to respond?
Thanks very much, Daniel, and I think you raised some very legitimate concerns given what we've seen by the LNP governments in both New South Wales and Victoria in terms of what they said and what they did. In politics, of course, more so than ever, you need to judge the political parties by their actions, not by their words. We've seen them point blank say they won't sell the assets, they've sold the assets. So you can almost guarantee that when they tell you that they're not going to do it, that they are. And as I said, you can only judge by the action. So you raise very legitimate concerns. In fact, one of the core values and principles, we have 21 of them for the Australian Party, is in fact that those independent boards will be protected. Of course, and I think it's an absolute insult when the cost of living prices and pressures are going up left, right and centre to have anything less than CPI. We have said that any government sector wages should be a beginning point of CPI, and I think we've done it we've seen it with the police service at 2.5. We've seen it right across the board in terms of, and I think the government has failed in terms of that commitment. In terms of on the financial side, I do understand that they are very protective of the independent umpire. However, I have very grave concerns and reservations of the sincerity of the LNP's position in this, and I think, and rightly so, all QNU members should. I respect the Shadow Minister's comments here today, but I would say that there's a much more cynical agenda as part of a bigger machine in terms of following their counterparts in New South Wales and Victoria. Rest assured, we will protect those independent umpires at all times, and we will unequivocally have that position that any EBA agreements would be commencing at CPI as a minimum. I don't think it's very fair, particularly for young couples trying to hold the mortgage down, that their budgets and household budgets are increasing, yet their salaries are decreasing. So I think particularly also with the aged care, there's a disparity. Of course, there's a vast disparities in terms of the salary, in terms of the salaries there, which I think needs attention sooner than later.
Thank you very much for that. Thanks for the question, Dan. That was great. Now, I've got some questions from some people who are not here, and they're on workforce planning, and I'll start at this end of the table, so Aidan, be prepared to answer first. The question's from Catherine. She's from the Robina campus of the Gold Coast Hospital. There is an issue for our graduate nurses. More money needs to be made available to train and employ graduate nurses. I am an EEN and have a permanent position within Queensland Health. I work 8 shifts a fortnight. Currently I'm at uni getting my degree, and I have been told that my employment will cease when I become a registered nurse. I know of other nurses out of work because they were unable to get graduate employment. This does not seem right. There are 260 student nurses in 3rd year at my university. What will your party do to help address this issue?
Well, I think it's a very valid question that Catherine has, and actually I will give credit to the government in terms of what they've done down at Robina. I think that's been a successful training model there, but what we have seen a lack of, and the disconnect, is the second chapter, which is professional development, ensuring that they can actually find employment after their training. I think it's a bit of an insult to say if you take one more step higher, that's it, you've done your dash here. The reality is we need to have legislation and certainly have incentive and provide the necessary funds to ensure that they can go to the next level without being penalised as a result. And I think that also comes back into what I was saying before, if there is no incentive to have those qualifications and certainly have those incentives to particularly have their rural and regional postings, then what we'll see is these people, not only will morale go down, but of course the service delivery then will be compromised in terms of those people having the necessary qualifications to deliver what needs to be done. So I think the first step right in terms of what is there at Robina, in fact a couple of my friends have gone through that, so it's been very successful, but in terms of the next step in empowering them, I think that's where the disconnect is. I think that's got to be put under the microscope to ensure that they're empowered with those qualifications, and of course they can have those the necessary opportunities to be able to then enact those qualifications and to reach their potential.
Thank you very much. Minister.
Thank you very much, Catherine, for the question. We're absolutely committed to growing the workforce within our public hospital system, evidenced by the fact that we've doubled the number of nurses working in our public hospital system since 2005, and I gave the numbers earlier of what we've done in the last 3 years, 6,300 clinical staff, and probably 60 to 70% of those would have been in the nursing cohort. We're able to do that because we're actually investing more and more funds into, in effect, job creation within the hospital system. We've got the biggest building program and expansion of our emergency departments and our medical and surgical wards and other important parts of hospitals right around the state. We're rolling out 1,700 extra beds over the next 3 to 4 years and 250 treatment spaces in DDs. So expanding the physical capacity, and so that's where that's what will drive the uptake of more and more nurses into our hospital system. What is important, of course, is to ensure that new graduates coming out do in fact have these opportunities to take up full-time employment. It's a challenge in any industry where people come out of their trade, out of their training and looking for permanent full-time work. I believe that, particularly given that the expansion of the hospital system's mostly happening in a regional area, and Gold Coast is an example and Sunshine Coast is another, that the job opportunities are going to accelerate more quickly in the regional areas than they will be in metropolitan Brisbane. And so the opportunity to employ on a permanent basis new graduates is going to improve significantly. Further, with the setting up of the networks and the governing councils and the involvement of the clinical staff in the decision making about how, for example, the Gold Coast network functions, there's going to be a far better opportunity for clinical staff and nurses to have an input into professional development and the employment opportunities of new graduates that are coming into the system from university and training in that regional area.
Thank you very much. Shadow Minister.
Can I start by saying I understand the average age of nurses in the state is around 48 years, and I think midwives is in the early 50s, as I understand at this point in time. My concern is that we have, as I said earlier, an ageing population and a chronic disease situation developing right here in the state at a time when we should be bringing more graduates through and then into the RN on a full-time basis. I am very concerned to hear that on the Gold Coast, it would appear to be that once you undertake a course of study and get to a level, you are then shown the door. It worries me that we have a system in place that is not appreciating that what we have is an ageing cohort, with all due respect, and then a young cohort who are moving through, who are eager to take up the cudgels. This is what we need to encourage. We have had a loss of nursing staff over the past 5 or 6 years, moving from nursing into management into other areas as well. This is the time when we should be encouraging nurses to move, or ENs, EENs and the like, to move through to become registered nurses and working in our health system. The LNP understands that unless we get the mix right, we're going to find ourselves in time to come with the age of nurses on an average growing and growing, and younger people not filling the void. Now that must be arrested, and I agree the network is one principle that we have to utilise to ensure we get the young people we need into medical field, into nursing, into doctors, because without them, in time to come, we're going to face a massive shortage in nurses. I understand that the National Health Task Force is about to release an interim report that shows, I think it's across the nation, a shortage by 2020 of 100,000 nurses. 100,000 nurses shortage within 8 years. Now, if we're turning young trainee nurses, if we can use that term, away now, that figure is going to escalate. We've got to arrest that immediately. Otherwise, we're going to be in serious difficulty within 3 or 4 years.
Thank you. Adam?
For me, the only thing that can explain the situation described in the question, where we've got a projected shortfall of, I wasn't aware of the 100,000 figure, but the QNU's figure of 14,000, shortage of 14,000 nurses by 2014, and not be engaging all of these nursing graduates. The only way that I can explain that in a sensible way is by looking to budgetary constraints. So for me, that brings me back to the remarks that I was making at the outset, which is that we need to try to intercept this burden of preventable chronic disease before it hits our hospital system. This 30-something% that's landing on the doorstep of our hospitals. This is the only way that I can see that in the long term we can cut these costs and at the same time give people better health outcomes, is through a greater emphasis on primary and preventative healthcare and keeping people out of the hospital system, freeing up the money to employ vital staff such as nurses to make sure that we don't end up in this situation of projected shortage. So some of the policies I was outlining at the start are ones that we've been pursuing at the state level, which I think would help with that. And also at the federal level, you're probably aware that the Greens have kind of been chipping away at this idea of dental care and oral hygiene being included in the public health system, being included in Medicare. And so far, we've already secured in excess of $200 million through our work at the federal level. The Brotherhood of St Lawrence, in their report that they released late last year, I think it was, said that poor oral hygiene was the largest preventable cause of acute hospital admissions. So that, once again, there's this kind of false economy of trying not to include dental care in the public health system, but you end up paying for it ultimately anyway at a more expensive end of the spectrum where it becomes a far more serious problem and lands in your hospital. So I think that's where our focus needs to be, to reduce the expenses in our hospital system and free up money to pay for hiring adequate staff.
Do you have any comments to make about that, Adam?
Only that, again, it sort of comes back to the same problem in that the only reason that you would be requiring nurses under those circumstances to be working the night shift is because you've got a shortage of staff and you're unable to find other staff who are in a different stage of life where it's more appropriate for them to be working those shifts. So it sort of, for me, comes back to the same set of problems and the same set of solutions. You need to free up money to have more staff available so that you've got greater flexibility and greater capacity to connect the appropriate members of your nursing workforce to those sorts of duties. I also understand that from what I've read, and again, I'm not sort of aware of all the specific detail, that one of the issues still in dispute with the enterprise bargaining agreement is about penalty rates for night work, and that's obviously something that also needs to be addressed if you want to make those night shifts attractive and also sufficiently rewarding for workers. They need to be remunerated accordingly.
Thank you.
I think this is exactly the outcome of the nurses as an average, as an ageing population base, and exactly why we have to attract younger nurses and retain nurses within Queensland Health as part of the workforce. Can I just raise one point? Adam made the comment about putting money into the preventative end. Can I say this? The acute end is here now. The chronic disease is here now. The issues we're facing about chronic disease is here now. So when you start pulling money out of the acute end, you need to be very cautious that you are actually pulling money out of treating people who have comorbidities and placing it in the preventative end. Certainly the balance must be struck, but I think it is simplistic simply to say take money out of the acute end and put it down there. That's a long-term strategy, because over the next 5 to 10 years we're going to find ourselves facing significant issues: cardiovascular disease, diabetes, renal, obesity, the Indigenous population, mental health issues. They're here right now, and we need to cope with them right here and now. The issue of a nurse at 60 years of age in Caboolture having to attend at night duty is a direct consequence of an ageing nursing population. And that can only be addressed by a policy and a process that engages younger nurses to move on through. The fact is that we have nurses who do have to take on that role at that age because the population of nurses is not able to cater or cope with the work that is required of them at this point in time without a younger cohort coming through. It just to me makes incredible sense that Queensland Health and any government must work with the QNU to develop a system whereby younger nurses are engaged and trained right through, not just in regard to the wards, but also specialised areas of nursing as well. And that's where we start to tackle the long-term concerns that we have in regard to chronic disease, ageing disease, and also the age of nurses as well.
Thank you. Minister.
This is an area where I think a lot of hard work needs to be done over the next couple of years. In conjunction between the following people. Certainly HR people at a central office level, but particularly at a network level and a hospital level. Because what this illustrates, in my view, is the lack of flexibility in the way in which the staffing model is created at that hospital or other hospitals to cater for the availability and the preferences of particular staff. It ought to be there ought to be a far bigger role to the QNU and other representatives of other parts of the workforce in ensuring that the locally based workforce is able to engage in employment at the hospital or in the health services more along the lines of what is suitable for them. For people in their age, in their 60s, to be required to work at night shift when clearly they would prefer to work a day shift and a weekday shift as well, I just think is just not good enough. And I think one of the problems of Queensland Health in the past being so centrally driven with its HR policies, that they don't look at what the opportunities are from the workplace up about how flexible you can start to be in making appropriate arrangements that suit different sorts of workers, different age groups of workers, what the personal and family circumstances are of workers. It's a big system, but I think it's lost its sensitivity, illustrated perhaps by other events that have happened, lost its sensitivity to crafting a workplace shift arrangements and working relationships that reflect the needs of workers in that particular area. And that's one shift I would like to see driven both centrally and through the networks when they're set up in 1 July.
Thank you. Aidan.
Yeah, thanks. I think Helen raises a very valid question, but I don't think it's unique to just nursing. I think what we're seeing with an ageing population is clearly we're not replacing ourselves. People are certainly, and the pressures, of course, with cost of living is, I think, intrinsically one of the reasons preventing us from replacing ourselves, which of course then creates this phenomenon known as the ageing population that is faced to Australia. I think it's and the problem, of course, as a result of that is you've got older people working at a later age, holding on to their jobs on one hand, and then on the other hand, when the younger people are trying to get the jobs, they can't access them, so it bites both ends. And in fact, there's some Liberal Party MPs that would probably like to see the age probably go up to 80 or 85 years old in the workforce. By the time I get there, I'll probably hit 80 and looking at retiring then, in terms of where the policy tends to be heading. I think Adam made a very valid point though, and I think it was probably misrepresented in terms of the saying goes, a stitch in time saves nine. I don't think Adam was looking at taking the money away from the acute end. I think it was actually saying we should be increasing the preventative end, because it's a vicious cycle and it needs a circuit breaker, because every dollar that you invest from a preventative point of view, you will undoubtedly save the dollar at the acute level. But if we concentrate only on the acute level, then we're going to get what we've always got, which is clearly unacceptable. So I think that's a very valid point that he makes. Simplistic as it is, that's as simplistic as it needs to be. I think if we have the total focus on the acute level, then of course it's only going to cost us more and more dollars in the long run. So I think obviously, the question, whilst it may not sound like it links with cost of living, I think it directly does, and I think it's not just unique to this industry, but I think we've got to look at the overall picture in terms of how we're going to deal with the ageing population on a far broader scale than just an isolated question in terms of why people are working at such a late age in these shifts that are undesirable.
Thank you very much for that.
Any chance I can make a quick clarifying comment?
Oh, clarifying comment, Adam.
Yes, thank you, Aidan. That is what I was saying. I actually was talking about a shift in focus, not a shift in funds. Okay. And the policy measures that we've already announced don't actually take money out of the acute end of the health system. They take money from elsewhere in the budget. And also the Dentacare stuff that we're pursuing at a federal level obviously doesn't affect the state's budget either.
Thank you. Thank you very much.
But you're right, it is a long-term payback, but it's something that we need to start investing in to get that long-term payback.
Okay, thank you. Now the next question is about re-entry and refresher programs, and it's from Jamie in Brisbane. And I was going to say she, but it may not be a she, so I won't assume. Many nurses leave the profession to have a family, and those who are out of practice for 5 years must complete an approved re-entry to practice program. Queensland does not have such a program at present. Given that the health departments of the ACT, the Northern Territory, South Australia, Tasmania and Victoria provide re-entry to practice programs for nurses, some of them for free, what is your position or strategy regarding the Queensland Government providing such programs for Queensland nurses? Aidan.
Yep, well, Jamie has a very good point that I think obviously then the first point we go is to look at the different models in the ACT, the Northern Territory, Tasmania, Victoria, and of course we could probably even get one up on them and actually refine if there are any loopholes or anything that can be improved. So clearly I think that's something that a lot of people who go on to maternity leave and then decide to get back in the workforce can find it very, very hard. So the least amount of hurdles that we can put on them as practical would be obviously certainly the way we should go. But I think also in that time, if they leave for the period of 5 years that Jamie suggests, there should be not only the refresher courses, but there should be avenues whereby they can actually accrue a minimal amount of time that they can with their work and family balance, so that the refresher course doesn't need to be done in all one hit. Rather, they keep that refresher course going throughout the time they've had off. So there should be a variety of models that best suits the situation that they're in with their family to ensure that there's a smooth transition when they decide to go back into the workforce.
Thank you very much.
Queensland Health and the QNU have for some time been developing working together and contributing their views in developing a nursing and midwifery workforce plan. And that it needs to include, and it's probably taken longer than what it ought to, and that said, it will take less time should I have the opportunity to get my hands around the throat of that exercise, if I can be blunt. That plan ought to be addressing issues like was raised with Helen, a 60-year-old nurse who is not saying she doesn't want to work. She's saying she doesn't want to work on night shift. And that's not an issue of an ageing workforce. There's a bigger collective issue of an ageing workforce, but this is a person who wants to keep working, but have more suitable working circumstances for her age. So that ought to be picked up in the plan. The other thing, then coming to Jamie's question about re-entry program, we invest so much into training nurses and midwives in the first place. I mean, it's the best human capital you can think of, next to teachers, I would say, frankly. And then for us not to maximise the opportunity for people who want to come back into the workforce to be refreshed in their skills and re-enter, and start resuming the pursuit of their profession. I think it's it's absolutely vital that we do that. So I am 100% behind looking at ways in which we can re-engage presently disengaged nursing and midwifery staff to encourage them to come back into the workforce. That needs to be part of the 5-year, 10-year workforce planning strategy, because the numbers will be there that will tell us. And there'll be different strategies needed for different people in different circumstances who are presently, as they say in the blue-collar industry, working out of the calling, but who want to come back into the calling. So we just need to be mindful that there'll be a variety of different circumstances for people and craft the re-entry options to maximise the opportunity for people in diverse circumstances to re-enter the workforce.
Sorry. Sorry.
You're right.
New way of cutting him off.
That's right. Mark.
I was contacted by a nurse here in Queensland about 12 months ago, and she had left the profession or occupation to have a family, and she couldn't get any re-entry courses or studies or whatever to gain entry back into Queensland as a nurse. She had to travel to Victoria to do the course, if I recall correctly. And that took her away from her family, her children, her husband, not just once, but on a couple of occasions. So the cost involved in that alone was significant, not just in the dollar terms, but also in the fact that her family was without her for a period of time. I think that if we have a nurse or a midwife who undertakes the degree of study required to achieve the qualifications in either or both, and that person then leaves the workforce, there is no reason why we should not have a course here in Queensland allowing that person to come back in. Because as we know, as we progress in our profession, it's not just the clinical knowledge that we gain, or you gain as the case may be, it's so many other things of a corporate knowledge base that don't come with an immediate graduate. And I think by putting in place a system whereby someone who leaves the profession wants to come back in right here in Queensland, gains the qualifications to do so, we gain so much more. And I think it is an excellent idea, and it's an idea that we would certainly encourage at a time when such nurses are leaving in such numbers at this point in time. If we can attract them back in by applying or allowing them to apply for this form of study and then get them back into the Queensland health workforce, it's a win-win scenario. You simply, in corporate Australia, you don't throw away good knowledge. So we should be going out there and chasing that knowledge and trying to get them back into Queensland health in our public health system. I think it's a fantastic idea.
Thank you. Adam.
I must confess I was actually still sitting here musing on preventive health and didn't listen to the question. Can you run it by me?
I certainly can. It was about nurses leaving the profession to have families, and after 5 years you've got to do a re-entry program. There is no re-entry program in Queensland, but there is in other states. So do you have any comments about that?
My understanding was that there was re-entry qualifications that could be got through the private sector by paying it, are they not?
Not in Queensland.
Only elsewhere. Yeah, right. Yeah, well, I guess obviously if you lose a very experienced worker from the workforce, then you've lost even more than somebody who's come in fresh and doesn't have so many runs on the board and so much experience. So it's an even greater loss, and there are even more costs associated ultimately with trying to get somebody to a point where they can offer the workforce that same level of skills and knowledge and experience. So absolutely, I think a course like that should be offered in Queensland to get those workers back into the workforce. I guess then the difficult questions come up about who pays for it and where the money comes from. And you know, I'd be kind of interested in engaging on the detail of that and how that would work. We've sort of been holding ourselves to a bit of a strict discipline of sort of not making wild promises that we can't fund. So I guess I'd want to know more about the detail of how that would work before saying anything firmer about it, aside from I can see the merit in it. I'm very receptive to the idea.
Thank you. That's great. Okay, we're back to the questions from the floor now. The next question's from Simon Mitchell. Simon.
Thank you, Madam President. Panel. In the public sector, how will your party ensure that the non-wages entitlements for nurses and midwives are delivered? For example, full funding implementation of the business planning framework, the tool for workload management. Also, given the attacks on nursing workload management tools such as staffing ratios interstate, will your party provide a commitment to preserve the ability to include workload management mechanisms in all awards and entitlements?
I just missed the first part of the
absolutely,
question.
Simon. Would you mind repeating the question again, because there was a lot of detail in there? Thank you.
In the public sector, how will your party ensure that the non-wages entitlements for nurses and midwives are delivered?
Non-wages.
Non-wages, right, okay.
For example, funding full implementation of the business planning framework, the tool for workload management.
Yep.
Also, given the attacks on nursing workload management tools such as staffing ratios interstate, will your party provide a commitment to preserve the ability to include workload management mechanisms in awards and agreements?
Adam, would you like to take the floor first, please?
Sure. To the second part of the question, yes. To the first part, how would we... You're going to have to run it by me again. I must confess I'm a bit fuzzy about what the question is.
It's a bit of a complicated question.
Could you explain the question, please?
Yes.
Yeah.
So for public sector agreements, this is what I think. Shout out if I get it wrong, team. The non-wages entitlements for nurses and midwives, so leave wages aside, the thing that's most important is the implementation of the business planning framework. That's about staffing levels, things like that. I think the question is asking about that. So how, given the attacks on nursing workload management tools such as nurse-patient ratios interstate, and that's been all the stuff that's been in Victoria, how will your party provide a commitment to us to preserve the ability to use our business planning framework as it is?
Okay.
Yeah.
The QNU framework.
Yes.
Right, okay,
Well, it's a joint Queensland Health and
my apologies. Yeah. Okay.
And it's a complicated tool, Adam, but it's very, very responsive to nursing workloads.
Okay, sure. Yeah, I mean, I'm not familiar with the tool, and I'm sort of not across the detail, but in sort of broad principle terms, I think it's essential. I guess this sort of comes back a bit to a response I gave earlier this evening, that I think issues of workload management and the proper functioning of any workplace are legitimate concerns for the workforce and for them to be involved in and to have a voice in. I guess the commitment I can give is by saying that I'm aware of and committed to those principles and receptive to hearing from the workforce, and especially through its legitimate union representation on what's needed in the workplace to help manage the workload and ensure that it's sustainable and that we get good service delivery outcomes for the community.
Thank you. There's a really good course that the QNU run on business planning framework. Probably worthwhile coming along. You'd be very welcome.
Is that an invite or a...
Well, that's probably an instruction, really. I think you should know about it.
Simon, I want to ask you a question. Can you explain the tool to me, please? I want to be clear in my mind what I'm dealing with. Can I indicate to you you've got half an hour?
Yeah, that's right. No, he's got 2 minutes. I've got the bell.
2 minutes. The business planning framework is a prescribed methodology for the planning, the management and the surveillance of the business of nursing and midwifery. It's based on a balanced scorecard, meaning that the services that nurses and midwives provide must meet the criteria of effectiveness. They must be able to do what they're designed to do. They must be efficient. They must be safe for patients as well as safe for staff. They must be appropriate. They must be responsive, and they must be accessible.
So you're talking about clinical outcomes as well as...
Yes.
Okay.
So,
okay, fine. Okay,
so
fine.
and the reason it's a big issue for nursing and midwives as a workload tool is that in order for us to be able to provide that service and ensure the quality of service for patient outcomes and for women, we need to be able to manage our workloads.
Okay. And it was determined by the QNU in conjunction with Queensland Health?
That's correct,
Okay.
jointly.
And what it is, I apologise for asking these questions, but I want to make certain I understand the question before I make a commitment. What you're saying is this delivers better clinical outcomes for patients and also better outcomes for nurses and midwives as well, correct? Okay. The LNP, so I've always said that listening to doctors and nurses and understanding their issues, their concerns and their answers is the way forward to better clinical outcomes and better outcomes for all clinicians across all sectors. If a tool exists that has been developed by a body that delivers outcomes and also protects the individuals who give the outcomes, the LNP would support that. Because at the end of the day, medicine, whether public, private, primary, acute, whatever you want to call it, is about outcomes for the patient and also protecting the rights of workers and also the entitlements of workers. So I have no qualms in endorsing a principle that does all that. There's been comment tonight made in relation to what happened in Victoria and New South Wales. Let me make this very clear. What happened down there is not the LNP. We're going to work for Queenslanders right across the board. Clinical outcomes will be the mantra that we will have in relation to delivering health services across the state. If I'm the Minister, I can't do that without nurses, doctors, paramedics, allied health professionals on board. They are pivotal. Human beings are pivotal to clinical outcomes. And we will work with them on a day-by-day basis in networks, Medicare locals, GPs, and across the sectors to make certain we get the outcomes. And if that tool delivers outcomes, it will be endorsed.
Thank you. Minister.
Well, I can state categorically that we are committed to not just the principle of the business planning framework, but the more effective delivery of it in the workplace, which I think is really where the challenge is. Yes, it's a prescribed framework and it's an appropriate framework. In any workforce, in any industry, you must have a workload management tool or device of some sort. Otherwise, you'll get poor outcomes, and both for the business as well as for staff. So the BFP, I think the real challenge is about how you deliver its effective implementation in the workplace. I've talked to nurses at many hospitals. I talk to the delegates at most of the hospitals when I get there. And aside from management, so you get to tell me what you want to tell me without red lighting yourself. And I think that's the real challenge is actually implementing. So we are committed to implementing fully the BFP, not just the principle of the BFP. I think when we're talking about non-wage entitlements, you've got to also remember what we have committed to as a government. And I haven't mentioned it previously, so I'll take this opportunity because I think it's relevant. And that is the common award that we have agreed to across 10 major working conditions and entitlements that are found in not just the Nursing and Midwifery Award, but in many other awards, so that we've got a common award that we've created for the health industry of awards, industrial agreements and policies and directions around those 10 key things that are being captured and put into a common award that's before the Industrial Commission of Queensland as we speak. And that also gives you confidence about security of employment, which is so important for your advocating in the workplace through a more decentralised decision-making process, that the BFP be implemented in practice in each hospital, not just embraced as a principle across the system.
Thank you. Aidan.
Yeah, thanks Simon for the question. Obviously very intrinsic and detailed, and no doubt we'll be picking your brains in the future in terms of any legislative reform that's required. I think, as I alluded to, my first 5-minute opening was the when you're talking about your workplace management mechanisms, it goes back to what we're talking about, the prevention and cure. I think what we're seeing, as I said, we're looking at a ratio. Some will say 5 to 1, I'd say 4 to 1 in terms of 4 bureaucrats to 1 nurse or doctor by the bed. clearly that ratio is where you have the disconnect. And until you change that, you're going to continue to get what you've always got. I mean, the further you go to Brisbane, you'll hear nurses say the ratio. You go to Toowoomba, they'll say it's 10 to 1. You go to Mount Isa, they'll probably tell you it's 100 to 1. But what we need to find there is obviously the disparity between, and you could use the analogy of a pit stop. You know, if a racing car pulled into the track and you had 4 people holding the petrol barrels and one was left to change the tyres, you'd think that something was wrong. This effectively is what's happening in the nursing sector. And what we've got to do is obviously make sure that they take that pressure off the tyre changer, nurse, and make sure that the bureaucrats are empowered to do the jobs that they're required to do without any extra, any of those positions, of course, being a heavy burden. Because, as I said, a lot of these departments are a reflection of how government has been operating for far too long in the state, where government has become its own worst enemy. They've tried to control everything, and as a result, everything's spiralled out. And of course, you have a public service that gets bigger and bigger and bigger, but gets more and more stifled as well. So I think what we need to do is see a realignment to balance the ledger in terms of what the duties are required, in terms of the bureaucrats and the nurses, and you get far better outcomes in the long run.
Thank you for that. Our next question's from Karen Shepherd, who's going to ask a question about midwifery.
Yes, I am. I'm a midwife, so does your party support...
Excuse me, Karen, you might need to speak up a little bit.
Oh, okay, sorry. Does your party support the National Maternity Services Plan, which strongly recommends the midwifery continuity model include public home birthing services? Queensland is only one of actually 2 states and the ACTU that does not provide public home birth services. Will your party commit to introducing this as a part of a continuity model for midwife-led birthing?
Thanks, Karen. Aidan, would you mind responding first, please?
Sorry, what was the name?
Karen.
Thanks, Karen, for the question. This is one very close to my heart because 2 of my youngest brothers had home births, actually, very successful home births, mind you. And of course, this is always one of the controversial issues that, if something goes wrong, of course, then everyone goes to ground in terms of their position. Very much so, the Australian Party would certainly support, obviously, having these certain mechanisms in place to ensure that the risks were minimised. Obviously, if there were complications, they'd be obviously you wouldn't want to pursue having a home birth if those complications were identified prior to the birth. But I certainly think that that avenue in the past has worked quite successfully. Yes, there has been isolated cases where that hasn't gone to plan, but I do believe that is something that certainly the Australian Party would represent. We've had a pretty good hit rate in my family. There was 2 out of 9. So I think if you had the necessary resources for that, but of course, as I said, you have to be extremely careful in terms of the ones that were approved to have the home birth. But I don't see why not. When you look at the first Australians, they've carried on for 40,000 years, and they did a pretty good job of sustaining their race. So I think if we, in this day and age, with the resources we've got access to now, I don't see any reason why it shouldn't be supported.
Thank you. Minister.
I bring a very open mind to this question. I'm very strongly supportive of a far bigger role for midwifery care in our Queensland in our health system, not just the public hospitals. And I think it needs to be elevated in status and importance a lot more than what it has been. In terms of publicly funded home birthing, there are the 2 issues that I would want to firstly bring an open mind to, but also to carefully examine, and that is the way in which home birthing could take place that is safe for the mother and safe for the baby, and take the best clinical, but not exclusively medical, best clinical advice about how that can be done. So that's on the issue of safety. On the issue of public funding of that, I would again bring an open mind to that. I think that would have to be carefully considered as to how it might be staged if it was to happen. But I'm not the Treasurer, and to be frank with you, I'm not in a position to say yes, we would publicly fund it. So I'm being cautious and saying to you, to be frank, that I would bring a strong advocacy to that question, but I can't give you a funding undertaking at this juncture. I have personally experienced the extraordinary benefits and joy for parents of home birthing and many years ago, and so I am absolutely predisposed to that as an additional choice for birthing mothers and fathers to have in Queensland. But I'm being careful in my statement to, as I say, to be frank, I would want to be satisfied that it can be done safely in the way in which things happen, and also would have to carefully consider how that might be publicly funded. They're not necessarily linked, of course.
Thank you. That's great. Mark.
Karen, thank you for the question. I also share the question of safety as raised by the Minister. I certainly tonight couldn't give you that guarantee. I'd want to seek appropriate advice across a range of areas to see how it can be done. Can it be done safely? What are the issues involved in that? And take the appropriate advice. I'm assuming you're talking about low risk anyway.
Yeah, and there's policies and protocols and criteria and
Yep.
nationally done, has been done in use, there's been public home birthing attached to services in New South Wales since 2005 and across other states. I think Western Australia's been a decade, and there's there's certainly all that work's being done for safety.
So they're safe and successful, is what you're saying.
Very,
Yeah.
and it's been government
Funded.
And all of those things.
Thanks, Karen.
Those would be the areas I'd like to look at and what reports are available from that. But in relation to midwife home birth services, all I can say at this point in time is that I do have those concerns. They need to be addressed. If they can be addressed, we can then consider the best way forward. But I certainly cannot commit to that at this point in time.
Thank you. Adam.
I'll give sort of two answers. The first one is in the time that I've been lead candidate for the Greens in this campaign, I have been cornered by midwives on a number of occasions, and
they do that.
I bet you
they do that better than anyone.
And I find it a very interesting but very complicated area, to be honest about it. And I even at one stage called Senator Di Natale, our federal health spokesperson's office, and spoke to his senior advisor to say, tell me what the hell all this midwife stuff is, and still ended up a bit confused coming out the other side of it. I appreciate that, but I think this is probably a little different to what you're talking about, that with private midwives there are all sorts of problems with insurance and so on when it comes to... But you're talking about publicly funded.
Yeah, it's attached to hospitals and it's attached to practice midwives and the whole mirage of policy and procedure and all that sort of stuff there, and it's all built in, and all of those safety and all that sort of stuff and that.
Yeah, and so if all of those things were ticked off and it all comes out as being completely safe, then in principles terms, Greens policy always supports the greatest sort of range of reproductive choice and access to appropriate medical supervision and assistance to ensure that the choices a woman makes are safe and appropriately supervised. And also, there's some Greens members in the audience here tonight who've been nodding vigorously at me, so I assume that probably our policy already says that we love it, but our health policy is publicly available, so you'll be able to confirm that on our website.
Thanks, Adam.
Sally Ann, can I just have 10 seconds? I just realised something. We talk about mother's choice all the time. My little brother was born, and it's a hell of a lot cheaper because it cost him, I think it was a bag of sugar, a kilogram of butter and a dozen eggs. And I'm just starting to think it probably wasn't mum's choice, it was probably dad's. It just hit me then, 32 years later.
Thank you. Look, I've got so many questions here that the members in the audience and from afar want to ask you all, but I'm going to cut quite a few of them out and just pick a couple of the really pointy ones that we'd really like to hear your answers on. So indulge me if we go a tiny bit over time, but I will be controlling the clock. So the very next question's from Judy Matthews, and it's about maternal and child health. Judy, you'll need to speak up, okay? Yes, you will. Okay, it's over to you. It's all yours.
Never been a problem, mate.
Okay, this question is, the LNP has announced policy on maternal and child health service, i.e. 6 free nurse consultations at home after birth of baby. Given the shortage of nurses and midwives, where will the LNP find the nurses and the midwives to fill these roles, and why is it planned to outsource these new services to the private sector rather than expand upon the excellent existing Queensland health services in this area? But I'd just like to make an adage. I'm from the electorate of Gregory, and last week's paper, Cameron Newman has announced that he is publicly committed to re-establishing a maternal and child health service. This service will provide home visits for 2 to 4 weeks of age and free consultations at the community centres at 2, 4, 8 and 12 months for all mums and new babies. We have never not had a maternal and child health service. It's now called Child and Family Service. It's run from the Community Health Building located in the hospital grounds. We do all range of services. We are short-staffed. We don't have enough cars, but we do the whole outreach to the whole Central Highlands community.
Thank you, Judy. Thank you.
Everybody's paid.
With your indulgence, gentlemen, I will get Mark to respond first. My question to the other panellists, though, on the same issue, is that do you have any plans for maternal and child health service improvements? So I'll let the Shadow Minister respond first, and then I'll hand over to everyone else.
Can I just outline a little bit about the policy? I'm not aware of the particular article, but I think it referred to a statewide initiative, not just in relation to the situation in Gregory. The idea behind the policy is quite clear: to provide the assistance and, if need be, direction to young mums with very young children. We see this as part of the preventative measure that Adam was talking about, in that if we get young mums and young bubs and we get them to talk to a clinical nurse, male or female, on maternal and child welfare issues, we get the start in the family that we've been looking for so long, so that when they go at 2 weeks, 4 weeks, 2 months, 4 months, 8 months and 12 months, either to a visit to their home or to a centre for 45 to 60 minutes, they get the advice they may need on either maternal or child welfare issues arranged across a number of initiatives. In addition to that, what the policy does is, if they don't able or can't get the information from the clinical nurse, they then directed to other people within the community that can help them. So we're putting in place a preventative measure early on, so that maybe we can start addressing the issues that are chronic as time goes by, and not waiting until it is too late. Will it be a challenge? Yes, it is. But this is where I think we can start developing new initiatives for nurses to move into new areas as well. We can bring back the nurses who have left the system by providing them with a new career path. We can actually get younger nurses moving through, and here is another new career path they can start following. So what we're trying to do is develop a system for mums and bubs, and also bring nurses who have left the system back in with a new career path, and direct the new cohort, and there are a lot of cohorts, a lot of nurses coming through the system, into a new stream. And this is what we're trying to do by developing a mums and bubs policy. So it's across the spectrum. Now, the article you referred to, and I apologise, I think it refers to the statewide initiative, not in relation to Gregory itself.
Thank you. Thank you for that. Adam.
I'm going to say, as a midwife, we do that already. We do that. That's in place. That policy is there already. We do that.
Thanks, Karen. That's good. Thank you. Adam.
So what was the version of the question?
Well, I was just wondering. It's along. Yeah. Have you got any? Has your party got any plans for maternal child health service improvements?
Yeah, our policy specifically talks about not only recruiting more midwives, but also particularly trying to make them increase their availability in rural and regional areas. And it talks about measures such as ensuring there's greater access to clinical rooms attached to community health centres and those kind of things in those areas that are underserviced.
Thank you. Minister.
The policy that my colleague has just described, the Bligh government went to the 2009 election undertaking to do that. When we were re-elected, we went ahead and did it. And so that now across 18 centres in Queensland, as well as major public hospitals and community health centres, on an outreach basis as described in Gregory, approximately 90% of birthing mothers have, in the last 12 months I believe, if I've got my figures correct, have received a home visit, one or more home visits after the birth of their child. There is no cap in the way in which our program works on the number of home visits that that may be available, or visits into the community health centre, or to the hospital, or to the community health hub. No limit at all. The funding is not capped. The funding is provided to provide the service. The service is driven by the demand of birthing mothers. It started low in 2009, 2010, but we've ramped it up, and as I say, it's about 90% now, and we'll continue to drive that throughout the state. So it's a policy that was announced before the last election. With the election of the Bligh government at that time, we then went ahead and implemented it. We've implemented it, and we're continuing to roll it out and to penetrate so that more and more mums get access to this. It's uncapped as to frequency and it's uncapped as to funding.
Thank you. Aidan.
Yeah, thanks, Judy. In relation to the concern you had about outsourcing to the private sector, can you just read that part again? Was there a concern about that? Was that raised in the article?
Why is it planned to outsource the services to the private sector rather than expand on the existing Queensland costs?
Yeah, no, I'd be certainly against going into the private sector, because I mean, undoubtedly that'll just be a charged service in time. Absolutely, they'll look at their bottom line, and it'll be a big gap between the haves and have-nots who can afford it. So I certainly would be against even entertaining the thought or even going down that path. I think from what you've said is that you've just got to build into the existing structure. And if we have a political leader out there espousing his own policy, then it's one of those very rare moments where it sounds like to me that there's tripartisan support for something that already exists.
Thank you.
Point of clarification, if I may.
Yeah.
What I said before is delivered by publicly employed nurses and midwives in our public health system, and that's where it'll remain.
Thank you. I'm going to jump ahead now. The next question's from Leslie Douglas about accountability.
Yes.
Leslie? You might need the microphone, Leslie, because the team are going to want to hear your question.
My question is, how will you improve the accountability and communication within Queensland Health? Specifically, what steps will you take to ensure government policies are implemented effectively by Queensland Health executives and managers?
Accountability and what was the second?
The question is, I'll just reread that, Leslie, because you were a bit quick there. How will you improve the accountability and communication within Queensland Health? Specifically, what steps would you take to ensure that government policies are implemented effectively by Queensland Health executives and managers? And Aidan, would you mind taking the floor for this one first,
Yeah,
please?
no worries. Sorry, what was the first name?
Leslie.
Thanks, Leslie. That's a really good question, because I mean it's a bit of a cliche, you know, and accountability in government, when you put the two words, is almost a bit of an oxymoron. I think when you look at Bob probably wouldn't be too proud of me saying this, but we share the same platform with the Greens when it comes to an upper house in the Queensland Parliament. And whilst it may seem unrelated, the reality is we're the only state in Queensland where we have one, where they have the lower house. It was obviously abandoned in 1922. So as a result, any legislation that's properly implemented is always being compromised now. Without that second checkpoint or that board of review, it's a winner-takes-all approach. So it won't be just the health department where you're going to have a lack of accountability. I think it's government-wide. Every department will. We're in the uncanny position where, you know, regardless of which parliament's in, we've only had 4 changes, the least amount of changes in any other state. We had the Labor Party for 57 years, then we had a National Party here for 29 years, and we've almost clocked up at 20 years. The reason for that very slow-moving pendulum is because winner takes all, so they've got access to resources and they can do what they want without any real checkpoint. And when you've got a government that appoints the governor, the Director Generals, all departments right across, the CMC, the so-called independent bodies and all these commissions that pop out of the woods. When the Commission does something right, the government takes credit. When the Commission fails, they blame the Commission. I mean, this is the modus operandi of Queensland politics. It drastically needs an overhaul to get any sort of accountability into the Parliament. Until we get that Board of Review or checkpoint, we'll continue to get what we've always got, because we're in the uncanny position where the opposition could go to the Bahamas and have pina coladas for 3 years and we wouldn't know the difference. And that's an unfortunate circumstance in the political landscape in Queensland.
Thank you, Aidan. Minister.
Very important question. The dramatic and radical restructure of Queensland Health that we've already announced, and significant parts of which are already underway, are giving effect to a principle that I believe is fundamental to Queensland, to the delivery of health services in Queensland. And it's what I call the servant model of leadership. The only reason for a network board, or the only reason for a head office, is to better serve the frontline staff serving the community in the street, so to speak, or in the hospitals and the health clinics. The philosophical position is service of the centre to the frontier, not the front line, not around the other way, which is a total shift in mindset, I believe, in the way in which Queensland Health as a corporate organisation has functioned. That's why we are instituting the biggest shake-up of Queensland Health, and I'm delighted to be part of it, in a generation. Not just the creation of the networks and the governing councils and the role for clinical staff like nurses in that governing council, but also breaking up the back of office functions of Queensland Health into two separate, smaller agencies that have got a clearer idea of what their essential role is, where the lines of accountability are a lot clearer, with the opportunity for more effective communication. So the corporate service function is separated from the clinical and the policy function of the organisation, and leaving a small Ministry of Health more in line with the conventional Ministry of Health in a parliamentary system. But add to that, and this is where you've got to work from the bottom up, I think we've got to drive the decentralisation of decision making within the networks and within the hospitals and the community health centres and what have you, so that those who are on the front line, particularly nurses, have a greater say in decisions about how resources are allocated. Once you get a greater say about how resources are allocated, you'll have people paying attention like they have never done so before.
Thank you.
The driving force in relation to the development, or at least the delivery of policy, will be the networks. There's no question about that. The networks will be accountable to the public that they serve. They are required and will be required to interact with the public and to explain to them how they're implementing those policies. The total overview will rest with corporate office in relation to developing those policies, and the outcomes will have to be published on an ongoing basis in relation to bed occupancy rates, ED occupation rates, ramping, and those other matters that make a hospital system work effectively. Jeff has raised the issue of corporate office being divided into two. We oppose that. And I have spent the last 3 weeks travelling around this state talking to doctors and nurses in the public health sector. And they, without doubt, say to me they are very concerned about this two-silo approach for the reason that they fear two masters developing and the areas of grey between the two escalating and becoming more as time goes by. I am also concerned about hospitals in the far-flung regions of this state having to communicate with two different and separate entities, but potentially in grey areas where they cross over. If one entity is creating problems, making two entities, theoretically, and in my opinion practically, will double those problems as time goes by. We believe accountability will vest and lie with the networks, The corporate office will have to hold them accountable. The networks will have to publish data and detail and communicate with the public which they serve on a daily basis. And only by making the networks openly and fully accountable to those they serve are we going to get better outcomes and, in my opinion, better transparency in the health system in the state.
Thank you very much. Adam?
I think probably the single most important thing we could do to try to foster better public policy outcomes within health, but I think this applies across the public service, would be to... The current situation is that all senior public servants and public officials in the Queensland Public Service are appointed by the government of the day to short-term contracts. So and often when government changes hands, a number of them get the axe. So it puts them in a situation where their employment prospects are connected with the political fortunes of the incumbent government, which creates a systemic conflict of interest. In the past, when we had such a thing as a public service board that was responsible for the merit-based hiring and firing of senior public servants, and it wasn't within the power of the government to decide to hire them or to fire them. They could complain to the public service board, but the public service board would then make its own assessment of whether these public officials were acting appropriately or not. And that puts the public service in a situation where they're able to say to the government of the day, drawing on their own professional policy expertise and their experience in their portfolio, and give frank and fearless advice, which is what we all say that we want, which includes saying when a policy direction is doomed to failure or is not a good idea and so on. So I think we need a bit more of that in Queensland Health and across the public service. And I think the appropriate body to do it, and what the Greens have been advocating, is that the Public Service Commission be given those powers again to do merit-based hiring and firing of the upper echelons of the public service. And so they are appointed and fired according to their expertise and their performance, and it's all based on merit.
Thanks, Adam, for that. You want to make a comment?
Not on that, another issue.
Do you?
Just
That's
very
not
quickly.
allowed.
Oh, okay. All right.
It's not in the rules.
Okay.
However, I might just ask Beth to come and do some closing statements, because seriously, I do have a lot of questions here that we could spend all night talking to the panel, because there's so much we need to ask you about. But because of time, and I know you need to get away and we all need to get back out on the road as well, that I'll hand over to Beth. You want Jan's question? Yep, okay, absolutely. I can do that. Right, let me find it. Jan, go for it, your question.
I'm Jan and I work in the community, and my question is about equal pay for equal work. Are you aware that community health nurses, such as those working in generalist and mental health community teams, receive significantly less pay than allied health practitioners performing exactly the same roles? If you are elected to government, will you guarantee that all community health nurses will receive the same rates of pay as their allied health colleagues who are performing the same roles? And to give some context to this, I'm not talking about a few $100s, I'm talking about in the region of $15,000 a year. And I'm talking also about management and clinical areas.
Thanks, Jan. Adam, it's your right to reply first.
Yes, I mean, absolutely. I think there does need to be equal pay for equal work, regardless of what setting you're operating in, and we would be happy to make that commitment. And the problem's also particularly bad in aged care, but I recognise that there's little that the state can do about that, and our federal counterparts have been working away at that and will continue to do so.
Thank you.
Community health services will become a more critical component as time goes by, as we move down what I keep saying is the ageing and chronic disease issues we're going to be facing, and how they interlink with Queensland Health and also the Medicare locals is a question in my mind. Can I say this, Jen? I can't give you a statement today, but can I say this to you? I will give you a commitment that I will work with you and your fellow officers to achieve parity, but I can't say that I can give the commitment right this second in time.
Thank you. While you had the floor, do you want to make your comment now?
Yeah, can I make a comment just about the issue of criteria-led discharge that was raised in the paper, and I think Beth or someone else made a comment today about that. I am very attracted to that. I am very attracted to that as a principle. What I would say, however, is there are a couple of questions that I have to get straight in my mind, and they are, who sets the criteria? Are we talking about the physicians, or are we talking about some other criteria being set up? I want to understand more about that. I want to understand too, what type of patient are we talking about? I mean, I'm assuming you're not referring to ICU when you make those sort of comments. I don't know at this point in time. But are there types of patients you would like to consider and types of patients you would not consider for very obvious reasons? What are the qualifications of the RNs? Are we talking about them being skilled up yet again? Is that required, or are we looking at nod of the head there. So shake of the head, my apologies. So all I'm simply, these are the questions I need to look at before I come to a conclusion about that. I think the other issues that I want to look at are there any issues of liability that have to be addressed to protect the nurse, first of all, and other people involved? And the second thing, or the last thing, is this: in my opinion, this must be considered as one tool in freeing up beds within the hospital system. But I think my first couple of points are, who sets the criteria? What type of patients are we talking about in relation there too? That wasn't covered in the article that appeared in the Courier Mail, and I think it's just important that I understand where we're headed to with that down the track.
Thank you.
But I'm very attracted to the idea. I won't talk about physiotherapists or other people as well, which are referred to in the article as well, but I want to understand those questions before I can take it back up again.
Thanks, Mark.
And
Minister.
I think Daniel was dying to make a comment, but I won't. And I might talk to you after the meeting. After the meeting.
We'd all be very happy to teach you about criteria-led discharge.
Yeah.
Dan, I'll move on.
I know what criteria, what it means.
Yeah. Happy to teach you how it works. Or not work. Minister, on the real question, Jan's question, and of course criteria-led discharge, if you'd like to make a comment.
Firstly, can I just ask for a little clarification in relation, excuse me, in relation to your question? Community health, you're talking about community health nurses and allied health professionals employed by Queensland Health?
That's correct.
Right, okay. Then my answer to you would be yes, in principle I do, and that it would be through the process of a work value within the industrial relations, the conventional industrial relations process. I'm not familiar enough with the detail of the disparity that you identify to comment much beyond that. But there is, as no doubt you are aware, there's a work value process that can be undertaken by the parties, Queensland Health and QNU, through the auspices of the Industrial Relations Commission, to identify the extent of disparities between equal work done by different professionals, and then to look at how the remuneration is appropriately adjusted to reflect the equality or whatever the outcome is that the Commission arrives at. So I'm very familiar with the work value process from my industrial background, but I just don't know I don't know enough about the detail of the different classifications you're talking about. I would support very much that they go through that work value process. On criteria-led discharge, I commend the Queensland Nurses Union for the strength of its advocacy to broaden and deepen the skills of its membership and the nursing profession, and that includes their capacity to use a criteria-led discharge to assist in patient flow and access from and movement from the hospital, from one ward to another, but eventually, obviously, to home. Bearing in mind the indulgence that the Chair provided to my colleague, I might take a little bit of licence, if I might, but Sally. But seriously, I think that what the QNU's been doing around criteria-led discharge is excellent work, and I think we need to work a lot harder in that area to convince complementary professionals working with the nursing staff that this is a way forward to improve accessibility of the public to medical and health care in our hospital system, and also to free people up to be moved out of hospital to subacute care and then eventually to home. It's all about patient flow and making sure that nurses are appropriately qualified but to exercise clinical judgment that is well within their capacity to exercise. And I support that 100%.
Thank you, Minister.
Good. Thank you for your indulgence.
That's all right. You did very well.
Thanks, Jan, for your question. I think, regardless, I think it's quite obvious that there should be a level playing field in the terms of remuneration when it comes to community health services or allied health nurses. I think the reality is, though, and we can all stand here and say, yes, we're going to support it or we're not. Of course, the Australian Party would support that, but I think the more important question would be then how would you support it, because given the hundreds of millions of dollars, I think that's where the answer needs to lie, because as politicians we can all say yes and no. So I'll concentrate on where we will get that money from, and I think this is symptomatic of a very common theme right across the board. We've seen it in the police service, the teachers, every union's lobbying for money, and these people are getting wage rises less than CPI. And once you look at the bigger picture, which is where the Australian Party comes into play, we're not producing nation anymore. You've only got to look at things that are closing down. We have a mindset of government, and we have for the last 20 or 30 years, of selling and spending. So they sell our assets and they spend, whether it's fairy floss in your roof or whatever it is to get your votes back. That's what they'll do, and they spend billions and billions going out. As a result, we have an increasing public sector. We're not producing any revenue for the country, so of course we can't. The cost of living goes up as a result, but we can't increase those wages. So when you deregulate the milk industry, the sugar industry, we see the manufacturing industry collapsing. We've seen WOW go down the gurgler. We saw the tomato industry that produces 30% of the tomatoes. We see Coles and Woolies duopoly, which reflects the Coles and Woolies duopoly of politics. That's all it is. It's a reflection of the political system. Our economic system is a reflection of the political system. So we see our country as a nation, we're not producing, we're collapsing. So until we get in a mindset of generating wealth and producing, then there's no way that any government could promise to increase those wages. So, and that's the philosophy and mindset that we need to snap out of the 2-year political cycles, and let's look at a 20 and 50-year vision and empower the public sector.
Thank you, Aidan, very much for that. Mark wants to ask Beth a question, and then I'm going to get Beth to close.
No, certainly not. Beth, what I want to talk to you about, and it may well be that Daniel can answer the question as well, with the discharge policy, is it a situation that that liability, and I'm still concerned about this, will vest with the doctor if the criteria is met? Because I know the VMOs had a real problem with this in their bargain. They refused to, at least to my knowledge, come to the party, and that really stymied the whole situation. So the issue of is liability, Daniel, is not a question. I just need to clarify, is a criteria-led discharge passing for a VMO patient, shall we say, that back to the VMO as liability?
Yep. And it is also the case that that's been trialled in 10 Queensland Health facilities in recent times, and it's been totally proved to be safe and efficacious. So there's no reason for doing this other than people protecting their patch. That's what it gets down to. So I think it's really, we can't actually start sort of like talking about sort of like the need for more beds until we look and see whether we're effectively using the beds that we've got right now, and that's just a really responsible thing to do.
And it works well in the UK as well.
Now, Beth, I might hand over to you to close because we have run over time.
She's getting wound up.
She's getting wound up. She's
getting wound up.
We could be here all night.
I'm familiar with it.
Look, I'd just like to say thank you to our panel for coming along tonight. It is really greatly appreciated that you've given up over 2 hours in a very, very busy election schedule, and we appreciate all of you coming here tonight and answering the questions that we wanted answered. And unfortunately, there are about 8 or 10 questions that are still left. There's some fantastic ones that have come from rural and remote areas, and one on mental health and a number of other ones, which we might send to you offline if you want to provide answers to them, because these members have taken the effort to sort of write these questions into us. So we're sorry we didn't get to cover all of them. But it really is important that you come here and talk to us tonight, because it has given us an opportunity to delve a bit more deeply into issues that are important to nurses and midwives. Unfortunately, we haven't heard too many health announcements in this election, and we fear that it's probably going to remain that way, that there's not going to be a lot of big ticket announcements from any of the parties, really. And it's great that we've had the opportunity to sort of like unpack a fair few things tonight. I'd just like to sum up by just sort of saying we've also got as you're both aware, the ALP and the LNP would be aware that we've written to the Premier and to the Opposition Leader with regards to the EB deal that we've tried to negotiate, and you've given commitments tonight, and we've got this in writing too in terms of from the Premier and from the Opposition Leader today with regards to what they will do with respect to finalising an EB negotiation as soon as possible. I will say, however, we won't give up on our campaign in that regard. You would know that we've got an email campaign going right now. We're following that up with a hard copy petition, and we've got 857 of these to hand on to the Premier and to the Opposition Leader, and we'll continue to pass these on every week because our members feel very strongly about this issue, and we'll continue to provide the evidence of that to the Premier and to the Opposition Leader on a weekly basis. These are very uncertain times for nurses and midwives. They need certainty. They need certainty with regards to making sure their rights at work are protected and that they have a fair outcome in terms of EB. So thank you all for coming along tonight as well. It's been a terrific evening, and I'd like to ask you all to thank our panel for their attendance tonight.
The official handing over.
The red one.
You're going to have a green form government.
We'll give you a special copy. We'll give you a special copy.
Yeah, which
Thank you, everybody, for coming tonight. And are we going to stay for some supper? Is that correct?